Hi folks, last but not least, a brief introduction to gross anatomy of the skeletal system. As you're preparing for the exam, focus on the structure of a synovial joint, and on the differences between appendicular and axial skeleton. The individual bones that are listed here in the PowerPoint, that's really meant to be a reference for you to use during lab as you learn the bones. All right, so bones come together at joints, which are technically referred to as articulations. Joints, if you categorize them by function, can be categorized as immovable, right? The sutures between the bones of your skull are fixed and cannot be manipulated, regardless of what folks who do craniosacral therapy will tell you. You can't manipulate them in an adult, and you shouldn't in a child. So joints could be immovable, slightly movable, like the intervertebral discs, and freely movable, like synovial joints, right? And those are the ones that we really focus on because those are the ones that allow for the most flexibility of movement. Now, there are 6 different types of synovial joints. For this course, you do not need to know the differences between these. You'll learn that when you get to AP1. Just remember, synovial joints allow the widest range of movement. Now, the bones are held together with ligaments, right? Tendons, which connect muscle to bone and cross the joint, are important for reinforcing the connection between bones, but bones are directly knitted together with ligaments. All right, so let's take a look at a synovial joint. So a knee is usually the example that's used because it's one of the largest joints, and it's the easiest to visualize the various pieces. So within the joint space, the articular space, is a viscous lubricating fluid called synovial fluid. At the epiphyses of each bone, remember we have articular cartilage, which allows for the bones to slide against one another without pain. In the knee, there are fluid-filled connective tissue structures called bursa that reduce wear and tear on the muscle. So we find these between muscle and bone, sort of as a padding. There are ligaments, right? And I've only got the ligament drawn on one side here because I didn't. I want to be able to show you the bursa. The joint cavity is lined by a membrane called the synovial membrane, right? And that's what produces those cells produce the synovial fluid. So you've got the ligament that's attaching one bone to another, and we have the muscle being attached to the bone by a tendon. Right, and then at the other end of this muscle, there will be another tendon attaching to another bone. Now, arthritis is, right, arthro means joint, itis means inflammation. So it literally tells you what it is once you know the word bits, the meaning of the word bits. Arthritis is inflammation of a joint. Osteoarthritis is age-related arthritis, and it will happen to everyone sooner or later. It will happen to you earlier if you play a lot of sports or engage in a lot of activities that are associated with sort of pounding on your bones. Or in my case, falling off horses, hence my current problem. In any case, right, what we're looking at on the left is a normal hip joint. You have the head of the femur up here, and there is articular cartilage on both surfaces of the joint. As we age, right, remember cartilage doesn't have, it's avascular, it doesn't have access to nutrients and oxygen in the same way that other parts of the body do. And so cartilage wears out over time, right? It is exposed to a lot of friction. That decreases the joint space, which then increases inflammation, and when you have exposed bone, you're going to have pain. Rheumatoid arthritis is a very different animal. It can occur in people of any age and is an autoimmune disorder, meaning auto means self. So essentially the immune system decides there's something about the hyaline cartilage or molecules associated with the joint that requires destruction. Another way joints come into play with the skeletal system is with replacements. We can now replace a lot of joints, and there are a lot of different kinds of artificial joints. So you can have a hip replaced, or both of them. You can have knees replaced. And in the middle, what you see is sort of a diagram of an artificial knee joint, right? These joints usually come pre-assembled, right? So the surgeon, this is excuse me, go back here. This is a side view of the leg. This is a bone called the patella. It's the kneecap. This is the bottom of the femur. So you shave off part of the bottom of the femur and essentially embed the top part of the joint, and then, you cut off and remove the top of the tibia and put the bottom of the joint in. So it's essentially a spike that goes into the bone. These are usually made out of titanium, which is a metal that is inert, so it doesn't cause problems being in the body. We can also replace hips when they become so arthritic that mobility is compromised. So it's the same sort of image. You have a diagram of the full skeleton, in the middle a cartoon of the joint being replaced, and then on the far right an actual x-ray of someone who has had a joint replacement or a hip replacement. So this is a much, as you can see, right, the dark white is the metal implant. And as you can see, this is a really significant surgery. I'm always amazed that elderly folks can go through this in be walking around. All right, so appendicular and axial skeleton. One of the keys to remember, or sort of being able to identify which bones are part of the axial versus the appendicular skeleton, is to remember that our arms and legs are referred to as appendages, right? So the bones of our appendages, as well as what are referred to as the pelvic girdle, which is the hip bones, and the pectoral or shoulder girdle, which includes the scapula or shoulder blade and the clavicle, right? The bones of the upper arm join with the clavicle and the scapula. So those two bones are considered part of the appendicular skeleton. Likewise, the femurs articulate with the coxal bones, which are the two bones that make up the pelvis. So the pelvic girdle is also considered part of the appendicular skeleton. Being along the midline is not enough to qualify as being axial, although those bones are all located along the midline. So these bones fall into a couple categories. The bones of the skull, which includes the bones of the cranium and the facial bones, a bone that is the only bone in the body that does not articulate with any other bone. It sits on top of the larynx. It's called the hyoid bone. The vertebral column, so those are all of the vertebrae, including the fused vertebra of the coccyx and the sacrum, right? So it doesn't matter that the sacrum is articulating with the coxal bone. It's it's axial. And then finally, the bones of the thoracic cage or the rib cage. Okay, so I'm not going to talk you guys through specific bones other than the hyoid bone in this lecture because that's something that's better done in lab when you have models in front of you. But just make sure that you have this with you as a resource when we meet for lab. Except for the mandible, which is sometimes referred to as the jawbone. All of the bones of the skull are connected by sutures, right? And these are sutures in the skull. Remember, those are immovable. There's the bones of the cranium. Oops. This is a mid-sagittal view of the same bones. These are the facial bones. And then the hyoid bone, right? So the hyoid is just, if you put your hand on your throat when you're talking, just above where you can feel the vibration, that's where the hyoid bone is. As I said, it's part of the axial skeleton, and it's the only bone in the body that doesn't have a joint. It doesn't articulate with any other bone. All right, the vertebral column. The vertebra protect the spinal cord. And one of the things about the vertebral column, right, you don't need to be able to identify individual vertebra other than the sacrum and the coccyx, but you should know how many of each there are. And I always had trouble remembering this until somebody said, well, think about the times that people always used to eat, right? You have breakfast at 7 in the morning, you have lunch at noon, you have dinner at 5. So 7 cervical vertebra, 12 thoracic, 5 lumbar. The sacrum is formed from the fusing of independent vertebra, as is the coccyx or tailbone. All right, the thoracic cage. The thoracic cage is made up of the thoracic vertebra, and that's where the ribs connect in the back, as well as the sternum, which is where the true ribs connect in the front. There are 7 true ribs. There are 3 pairs of what are referred to as false ribs. False because they are not, this one should come around here. They don't have their own connection directly to the sternum. They connect to the cartilage. Oops, I shouldn't have done that. They connect to the cartilage. It's called the coxal cartilage. Or sorry, the costal cartilage that connects the true ribs to the sternum. So the false ribs connect to the cartilage of the true ribs. And then the floating ribs don't connect at all. They're usually 2 floating ribs. All right, so this is just another view. So the sternum is made up of 3 pieces, the manubrium, which is the top, the body, and then the xiphoid process. All right, appendicular skeleton. As I said, it includes the bones of the pectoral girdle. Remember, pectoral means chest. So the shoulder girdle, pectoral girdle, and the pelvic girdle. The pectoral girdle, those that organization is specialized for flexibility, while the pelvic girdle, as well as the lower limbs, are specialized for strength and weight bearing. Right, so you will eventually know all of these bones because we'll be talking about it in lab. In this slide, I just want to point out the bones of the essentially the pectoral girdle, where the humerus or the bone of the brachium or upper arm connects to the scapula and the clavicle. In this image, the humerus has been dropped down a little bit so that you can make out the scapula and clavicle. So the pelvic girdle is made up of 2 bones that are called the coxal bones. Right? So the bones themselves are called coxal bones. There are, within each coxal bone, so I'm going to just outline one of them. So that's a coxal bone. Within each coxal bone, there are named areas. So the ilium up at the top there, the iliac crest, the acetabulum, the ischium, and the pubis, which is closest to the midline. I care that you know coxal bones, that the pelvic girdle is made of the coxal bones, the 2 coxal bones. the sacrum, to which the coxal bone, both coxal bones are fused, is not part of the appendicular skeleton. It's part of the axial skeleton. So please remember that. The two coxal bones are fused in the middle, or not exactly fused, but they come together the anterior or ventral surface of the body, so in the front, by the pubic symphysis, which is fibrocartilage. Okay, and here's a reference for the bones of the pelvic girdle and the leg. In this course, you do not need to know the specific names of the metatarsals or, heaven forbid, the tarsals. You just need to be able to identify the part of the foot that's made up of by the tarsals, metatarsals, right? And then we've got our friends, the digits or the phalanges. All right, so that's it. I will see you guys on Tuesday. Hopefully I can stand up and reach my arm over my head by then. See you then.